The hip ball and socket joint is an amazing joint, very complex. Today we're looking at a few different movements. So bringing the leg in and across is called adduction, and bringing the leg out to the side is called abduction. And the adduction is performed mostly by the adductor muscles, so the adductor magnus, longus, and brevis, and the pectineus, and all of these start here on the underside of the pubic bone, the pubis, and the muscles travel down and attach to the inside of the femur. There's a longer muscle called the gracilis that comes down and actually attaches on the inside of the tibia. So the main motion is drawing the leg inward, as well as turning the leg internally, or medial rotation slightly as well. To the outside, the leg is abducted by, three main muscles. So on the back of the ilium here, these big red spots are the gluteus medius and the gluteus minimus, and they're underneath the big gluteus maximus. But these muscles come down and attach right here on the top of the trochanter of the hip, of the femur bone. And so they, draw the hip joint and the leg out to the side, called abduction. And those muscles tend to be very weak. The other muscles, the tensor fascia latae, or latae, and it comes down here from the outside of the ilium and crosses over the hip joint, and then becomes this big long connective tissue called the iliotibial tract, or iliotibial band, that comes all the way down and crosses the outside of the knee, and really serves as a huge lateral stability tissue. But at the very top there is a muscle there, and underneath these muscles there is a bursa sacs to try to prevent rubbing on these tight muscles onto this greater trochanter. The other than adduction and abduction, we talked a little bit about the medial rotation, turning the leg in, but turning the leg out. External rotation is extremely important, because the external rotators also are mainly responsible for stabilizing the hip joint in the socket. So when those muscles are weak, then this ball and socket joint is not well positioned. So as we go through our activities of walking and moving all day long, we're getting wear and tear within the joint that we really don't want to. So there's 6 sort of small muscles that work to externally rotate that hip joint. And one of the most important ones in terms of causing people problems is called the piriformis muscle. Now the piriformis muscle actually attaches on the inside of the sacrum, here where you can see the red, and then the muscle travels out and attaches right here at the very top of the femur bone, and you can see that it will do external rotation. So if we just look at how that muscle travels, it comes through and it does this. So what is it doing? Well, it is a muscle that can get very tight here at the greater sciatic foramen, this hole here through which the sciatic nerve runs. And if anybody's had sciatica, you know that it's that shooting pain down the back of your leg, and it can be caused by a few things, but it can be triggered by having this tight piriformis muscle. So our external rotators can be weak, but this one in particular can be very tight. So stretching it is important, and this is also when we take the tennis ball onto this fleshy area and sort of lay on that tennis ball, that it helps to get some release in this muscle. But otherwise we have the obturator internus muscle on the inside here of the ischium and the gemelli superior and inferior muscles as well. Then they come through here and and attach here at the top of the femur bone to externally rotate it. And the quadratus femoris is another muscle, and it starts right here at the bottom of the ischial tuberosity and again attaches right here on the posterior sort of face of the greater trochanter. And so all of those muscles work to externally rotate. So we need to keep the adductor muscles stretched out. They can tend to be tight. We need to keep the abducting muscles strong. And then we also need to make sure that we keep our external rotators strong, but as well keep that area stretched out and through our strengthening and stretching exercises.